Hello, my name is Gary Nicolaisen. This is speech number 3, informative speech. In this speech, I will be talking to you about the importance of communication in a professional setting. The chosen profession I have chosen is pre-hospital emergency medicine. Communication is vital in any sort of profession. Effective communication is so important in conveying to the public or one's target audience that they are confident and are willing to be able to do the job that they are entrusted. When you combine that importance of communication with a field like pre-hospital emergency medicine, the role becomes even more enhanced as you will be dealing with people who are in a state of panic and emergency. That is why the topic I will be discussing with you today is so important. In doing research, there was a study done by a James J.T. The study was about harms associated with medical care, and he was able to find that the number one role in patients receiving harm at the hospital is due to a lack of communication, and that is why this topic is so important. As an EMT or a paramedic, you will most likely be representing an agency, whether public or private. You will not be just freelancing, working on your own. You will be part of an agency, and in doing so, you need to carry that reputation that agency is competent and is willing of the public's trust. To do this, you need general communication skills and being a public servant, such as being kind, honest, a good listener, fair, trustworthy, and to have integrity. In dealing with the public, you will be presented with a certain amount of challenges. Some of these are due to difference in demographics out there, whether it is cultural, age-related, language, or disabilities. To deal with all these different scenarios you might encounter, your communication skills need to be even more enhanced and learn how to be adaptable. For instance, you're not going to talk to a infant or a young toddler the same way that you would talk to a senior citizen in dealing with a medical emergency. Some things you might say to one culture might not be acceptable to another culture or may be deemed inoffensive. Also, you may deal with people with language barriers or people that have hearing issues or other cognitive disabilities that you need to adapt your communication skills to. Another very important thing about pre-hospital emergency care is coming up with an assessment. An assessment is done to figure out what sort of body system is being harmed right now, what sort of emergency the person is having. And to do that, you need even greater communication skills. One trick or mnemonic that a lot of EMTs or paramedics use to get a good medical assessment in the field is the mnemonic OPQRST and sample. OPQRST stands for onset, provocation, quality, radiation, severity, and time. Sample stands for signs and symptoms, allergies, medications, past medical history, last oral intake, and events which led up to the emergency they are having. All of these are mnemonics, but to master them, you need to have a full comprehension of what effective communication is and how to integrate your questions into your medical diagnosis. There's another study done by Dennis Edgerly about the OPQRST mnemonics and about assessing your assessment. And he has found that those are both very vital in being a professional EMT or paramedic. Another role of communication in the pre-hospital emergency setting for the paramedic mainly is communicating to the hospital before they get there about your patient, what's going on with them, the history, how you found them, all their vital signs, their heart rate, and blood pressure. Doing this requires a greater amount of communication even still, as you will be communicating to a educated professional doctor or nurse. And in doing so, you'll be communicating, but you'll be even having to integrate more medical terminology that is spoken in the medical profession. In interviewing a paramedic for the Hawaii Fire Department, a Mr. Jake Steiner, who is a state licensed paramedic and works on the Big Island, he talked to me about making sure your patient communications to the hospital are very detailed, but at the same time being very concise and only including the important information. Oftentimes, they're communicating on the way to the hospital in the back of an ambulance while still having to take care of the patient. So they don't have a lot of time to go into too much, but at the same time, they need to make sure all the information they give is going to be very important and to help the patient and the hospital be ready for the patient when they get to the hospital. Communication in an effective professional manner as an EMT. To be able to do that, you need to be very effective communicator and you need to know the terminologies and the public servant, people interaction, people skills. To be an effective EMT, you need to be an effective communicator and you need to do a great medical assessment. To be able to do that medical assessment, you need to be a professional and an effective communicator in your chosen professional field. And thank you all for listening, and I hope you all have a great day. Thank you.